Good morning, everyone, and welcome to the Medicare Insurance Finders presentation on Medicare Gap Coverage. Today we're going to be talking about what Medicare Gap Coverage is. We get a lot of calls and emails and website requests just asking kind of what it is, what's the difference in that and a Medicare Advantage plan. We're not going to be going over a Medicare Advantage plan in detail in this presentation, but we will be going over what the Medicare Gap Coverage is. It should be 3 to 5 minutes. All right, first of all, a Medigap policy is health insurance sold by private insurance companies to fill the gaps in their original Medicare. Now, basically what this is saying is you have Medicare Part A and Part B, and there's deductibles, co-insurance, co-pays that go along with having Medicare. What these private insurance companies do is they offer Medigap policies, also called Medicare supplements, those are one and the same thing, to help cover those different costs. Every Medigap plan has to follow the same outline of coverage or the same summary of benefits. They're standardized, meaning that every single company offers the same benefits. So they're required to follow these federal and state laws. In some states, they may have applications done differently. They may say, okay, this state has no health questions. This state has to offer all plans to under age 65 individuals, but the benefits are the same in every state besides Massachusetts, Minnesota, and Wisconsin. And these plans are plans A through N, and this is in 2012. Here is the outline of the different plans, plans A through N. You can see that the plan F, if you look into the middle, is the most comprehensive plan. Plan G and Plan N are also very comprehensive plans, as well as Plan C. Those four probably make up 85% of the Medicare supplement policies sold today. So those typically would be one of the ones you would decide to choose in your state. What are some of the Medicare supplement carriers? Here we've listed some of the different carriers you see. There's Mutual of Omaha. They have several different carriers. United World, United of Omaha, Omaha Insurance Company. You have Philadelphia American and New Air and Manhattan Life, Family Life, United Healthcare, AARP, Gerber Life, Aetna, Forethought, Sentinel, and there's a lot of others. There's about 20 carriers that we use on the Medicare Supplement quote engine that you can find at Medicare Insurance Finders that will give you quotes instantly with the 20 carriers in 47 states. Again, the 3 states it does not do are the states that are non-standardized benefits. When do you want to buy a Medicare supplement policy or a Medigap policy? The best time to buy, as stated in the Medicare New booklet and the Medigap booklet, is during your open enrollment period. So what is the open enrollment period? Basically, this is a time period where you got 6 months beginning the first day in which you turn 65 and have Part B, where no insurance companies can ask you any health questions and you cannot be denied for any plan A through N that you want. This isn't to be confused with a guaranteed issue period. Those are covered in another video, and please watch that video to understand more about it. But this open enrollment period is a one-time thing. You don't get 2 of them. You don't get 3 of them. Let me say this. There is 1 or 2 states that allow under 65 people, whenever they first become eligible for Medicare, to have an open enrollment period, and then you can have it again when you turn 65, but that's very rare. Mississippi is one of those states, and there's a few others out there. But this is what an open enrollment period is, and it's a great time to buy because you can choose any plan you want. You don't have to worry about pre-existing conditions. They'll all be covered. If you had cancer previously or congestive heart failure or strokes, don't worry about any of that. It will all be covered. You can pick the best plan, the best benefit plan, whatever you want for that. If you're trying to look for a plan today, I recommend you contact us. You visit us on the web at MedicareInsuranceFinders.com. You call us toll free at our number, 1-800-800-1397. Option 6 will send you to any of the people here at our office. Our local number, we are actually based out of Mississippi. We have offices in most states, but our office here in Jackson has the local number 601-956-2028. And so that's the end of the presentation today. We thank you for joining Medicare Insurance Finders for this basic presentation on what is Medigap coverage. Thank you.